is that I know from the work I've done on health care for many years that if everyone's not in the system, we will continue to let the insurance companies do what's called cherry picking. Pick those who get insurance and leave others out. We will continue to have a hidden tax so that when someone goes to the emergency room without insurance, 15 million or however many, that amount of money that will be used to take care of that person will be then spread among all the rest of us. And most importantly, you know, the kind of attack on my health care plan, which the University of Pennsylvania and others have said is misleading, that attack goes right to the heart of whether or not we will be able to achieve universal health care. That's a core Democratic Party value. It's something that ever since Harry Truman we have stood for. And what I find regrettable is that in Senator Obama's mailing that he has sent out across Ohio, it is almost as though the health insurance companies and the Republicans wrote it. Because in my plan, there is enough money, according to the independent experts who've evaluated it, to provide the kind of subsidies so that everyone would be able to afford it. It is not the same as a single state trying to do this because the federal government has many more resources at its disposal. So I think it's imperative that we stand as Democrats for universal health care. I've staked out a claim for that. Senator Edwards did, others have, but Senator Obama has not.
Senator Obama, quick response.
Well, look, I believe in universal health care, as does Senator Clinton. And this is I think, the point of the debate, is that Senator Clinton repeatedly claims that I don't stand for universal health care. And you know, for Senator Clinton to say that, I think, is simply not accurate. Every expert has said that anybody who wants health care under my plan will be able to obtain it. President Clinton's own Secretary of Labor has said that my plan does more to reduce costs and as a consequence make sure that the people who need health care right now all across Ohio, all across Texas, Rhode Island, Vermont, all across America will be able to obtain it. And we do more to reduce costs than any other plan that's been out there. Now, I have no objection to Senator Clinton thinking that her approach is superior, but the fact of the matter is that if, as we've heard tonight, we still don't know how Senator Clinton intends to enforce a mandate, and if we don't know the level of subsidies that she's going to provide, then you can have a situation, which we're seeing right now in the state of Massachusetts, where people are being fined for not having purchased health care, but choose to accept the fine because they still can't afford it even with the subsidies. And they are then worse off. They then have no health care and are paying a fine above and beyond that. That is a genuine difference between myself and Senator Clinton. And the last point I would make is the insurance companies actually are happy to have a mandate. The insurance companies don't mind making sure that everybody has to purchase their product. That's not something they're objecting to. The question is, are we going to make sure that it is affordable for everybody? And that's my goal when I'm President of the United States.
Senator,
Brian, wait a minute. I've got this is too important. You know, Senator Obama has a mandate. He would enforce the mandate by requiring parents to buy insurance for their children. That is the case. If you have a mandate, it has to be enforceable. So there's no difference here. It's just that I know that parents who get sick have terrible consequences for their children. So you can insure the children, and then you've got the breadwinner who can't afford health insurance or doesn't have it for him or herself. And in fact, it would be as though Franklin Roosevelt said, let's make Social Security voluntary. Let's let everybody get in it if they can afford it. Or President Johnson said, let's make Medicare voluntary. What we have said is that at the point of employment, at the point of contact with various government agencies, we would have people signed up. It's like when you get a 401k at your employer, the employer automatically enrolls you. You would be enrolled. And under my plan, it is affordable because, number one, we have enough money in our plan. A comparison of the plans like the ones we're proposing found that actually I would cover nearly everybody at a much lower cost than Senator Obama's plan, because we would not only provide these health care tax credits, but I would limit the amount of money that anyone ever has to pay for a premium to a low percentage of your income. So it will be affordable. Now, if you want to say that we shouldn't try to get everyone into health insurance, that's a big difference, because I believe if we don't have universal health care, we will never provide prevention. I have the most aggressive measures to reduce costs and improve quality, and time again, people who have compared our two approaches have concluded that.
Brian,
so let's have a debate about the facts.
The last answer on this topic.
It is just not accurate to say that Senator Clinton does more to control costs than mine. That is not the case. There are many experts who've concluded that she does not. I do provide a mandate for children because, number one, we have created a number of programs in which we can have greater assurance that those children will be covered at an affordable price. On the point of many adults, we don't want to put in a situation in which on the front end we are mandating them, we are forcing them to purchase insurance, and if the subsidies are inadequate, the burden is on them and they will be penalized. And that is what Senator Clinton's plan does. Now, I am happy to have a discussion with Senator Clinton about how we can both achieve the goal of universal health care. What I do not accept, and which is what Senator Clinton has consistently done, and in fact, the same experts she cites basically say there's no real difference between our plans, that they are not substantial. But it has to do with how we're going to achieve universal health care. That is an area where I believe that if we make it affordable, people will purchase it. In fact, Medicare Part B is not mandated. It is voluntary, and yet people over 65 choose to purchase it, Hillary. And the reason they choose to purchase it is because it's a good deal. And if people in Cleveland or anywhere in Ohio end up seeing a plan that is affordable for them, I promise you they are snatching it up because they are desperate to get health care, and that's what I intend to provide as President.
About 20% of the people who are uninsured have the means to buy insurance. They're often young people who think they're immortal.
Which is why I cover
them. Except when the illness or the accident strikes. And what Senator Obama has said, that then once you get to the hospital, you'll be forced to buy insurance. I don't think that's a good idea. We ought to plan for it, and we ought to make sure we cover everyone. That is the only way to get to universal health care coverage. That is what I've worked for 15 years, and I believe that we can achieve it. But if we don't even have a plan to get there, and we start out by leaving people, you'll never, ever control costs, improve quality, and cover everyone.
With respect to the young people, my plan specifically says that up until the age of 25, you will be able to be covered under your parents' insurance plan. So that cohort that Senator Clinton is talking about will, in fact, have coverage.
Well, 16-minute discussion on health care is certainly a start. I'd like to change.
Anything more important? So I think it would be good to talk about health care and how we're going to get to
here's another
healthcare.
Important topic, and that's NAFTA, especially where we're sitting here tonight. And this is a tough one, depending on who you ask. The Houston Chronicle has called it a big win for Texas, but Ohio Democratic Senator Brown, your colleagues in the Senate, has called it a job-killing trade agreement. Senator Clinton, you've campaigned in South Texas. You've campaigned here in Ohio. Who's right?
Well, can I just point out that in the last several debates, I seem to get the first question all the time, and I don't mind. I'll be happy to field them, but I do find it curious. And if anybody saw Saturday Night Live, maybe we should ask Barack if he's comfortable and needs another pillow. I just find it kind of curious that I keep getting the first question on all of these issues, but I'm happy to answer it. I have been a critic of NAFTA from the very beginning. I didn't have a public position on it because I was part of the administration. But when I started running for the Senate, I have been a critic. I've said it was flawed. I said that it worked in some parts of our country, and I've seen the results in Texas. I was in Laredo in the last couple of days. It's the largest inland port in America now. So clearly some parts of our country have been benefited. But what I have seen, where I represent upstate New York, I've seen the factories close and move. I've talked to so many people whose children have left because they don't have a good shot. I've had to negotiate to try to keep factories open, sometimes successfully, sometimes not, because the companies got tax benefits to actually move to another country. So what I have said is that we need to have a plan to fix NAFTA. I would immediately have a trade timeout, and I would take that time to try to fix NAFTA by making it clear that